Hello, everyone. Welcome to Children in the Fields live Thursday broadcast. My name is Kendra Mosley from AFOP. I'm here with Caroline Deschak, Master's in Public Health, and she's here to discuss with me and sort of the elephant in the room that we've always been thinking about but never had on the show yet. So that is about migrant health on the International Migrant Trail. Carrie just graduated with a special mention from the Instituto Nacional de Salud Publica de Mexico with a master's in public health, as I just mentioned. Her thesis work analyzed food security and coping strategies in international migrants transiting Mexico. And she's also published several works on access to health, along with some other colleagues, for migrants in the Americas, both before and during the pandemic. We invited her here today to talk a little bit about how the migratory process contributes to increased vulnerability and poor health outcomes among migrant farm workers. We use the word migrant here to indicate international border crossing, but we know that can get confused. We also talk a lot about migrant seasonal farm workers, so we need to parse those out today a little bit. Right now, we're talking about the International Migrant Trail, how migrants who are on that International Migrant Trail struggle to access health and health services and food. All of that to say, welcome to Carrie. And I want to make a note of a few things before we get started. If you ever missed any of our broadcasts before, you can always go to our website, afop.org/CIF. You'll find them all right there again. There's been quite a few of them by now. So chances are you've missed one. So go to that page and you'll also find information on our contest there. Of course, our contest right now has finished. We've had all of our winners announced on August 31st, but we're still posting daily messages about each winner and their entry. So you may have been enjoying those last week and this week, and that'll continue through next week. I don't think I have any other announcements other than my usual invitation to anyone who's watching to enter your name in the chat and let us know where you're joining us from. And I'm going to go ahead and hide this screen so that it's not so crowded. And also, you can ask any questions that you want about migrant health, and we'd be happy to try and answer those questions. Our goal today is just, Carrie is joining us from Mexico, and I am in the US, so it's pretty cool. We're actually, in our conversation today, trying to connect the dots from Mexico to the United States, and how a lot of migrant farm workers, you know, they encounter a lot of issues before they even get to the US and start working in US agriculture. So we're here to talk about that. Welcome, Carrie.
Thank you so much. I'm glad to be here. Glad to be here back talking with AFOP and talking to you, Kendra.
Me too. I'm happy to be seeing your beautiful face. It's been a while.
From Cuernavaca.
First, I would like you to tell us a little bit about yourself. We know you pretty well because you used to work at AFOP, but what took you to Mexico? How long have you been there? And what got you interested in public health in the first place?
Yeah, so like I said, we've known each other for a few years now because I used to have the honor of working with you guys over at AFOP and as a program coordinator for the health and safety programs. And that was actually a huge learning experience for me and a jump off to what I've been doing in these past couple of years. I have been in Mexico for about 2 years now, subtracting the time that I just had to leave for a few months related to the pandemic. But I've pursued my master's degree here in Mexico under a Fulbright grant from the United States. My master's, which I just completed, is in public health with a special focus on nutrition and food security. And within that, I've been completing projects in what is migration and health. My Fulbright grant, which assisted me in getting this master's degree, was focused on my project being in migration and health and studying aspects of vulnerability unique to migrants as far as the ability to have a healthy and appropriate, dignified level of life.
It's a very important topic. So we're grateful that you're here to tell us some of the things that you've learned. But first, before we get into that, can you tell us, this is Hispanic Heritage Month. A lot of our migrant seasonal farm workers come from Mexico and or still have ties to Mexico, might go back and visit family there. Can you tell us what your favorite parts are about living in Mexico? What do you love about the people, the culture, and the food?
Yeah, I love that. And I love that it's Hispanic Heritage Month. This is the month too where Mexico, along with many of the Central American countries, celebrate their Independence Days. We just celebrated Mexican Independence Day here, which is an incredible time to be around. And something really, really unique and something so specially Mexican is this connection that Mexico and the United States have. It's so close, not just with commercial or economic ties, with familial ties. And it's something really cool to share on an interpersonal and on an academic and professional level around here, all the different experiences that people have with the United States. How many people love to speak to me in a little bit of English that they know or tell me about their family in California, some of which are farm workers in the United States, tell me about their family in Florida and a trip they once took to Disneyland or something even. That's an aspect that's really, really cool and really unique about Mexico. The food, on the other hand, is amazing. And when I say the food is amazing, I mean that we might have some problems down here with an influx of ultra processed food from the United States, and that's absolutely true. But when it comes to Mexican food, for real, it is incredible. There's a reason it was the first cuisine on the planet to be classified by UNESCO as an actual World Heritage cuisine before French food, actually. And it's so incredibly colorful, diverse, and natural, differs so much region to region. It's been so fun to explore that. As you can see, both my studies and my personal life completely revolve around food. It's not a secret.
I am jealous. Is there any particular dish that you enjoy the most?
There are a lot of them, and it's funny that a lot of them do share kind of similar ingredients or something similar, but they have completely different names from one way or the other. And that has a lot to do with the fact that the different native language groups of Mexico, before Spanish became, of course, the colonial language of here, the cultural dishes still have names that are based in Nahuatl or that are based in Mayan tongues, for example. And so that's one good way to figure out when it's a good one, if it has a name that's hard to pronounce for you. But for specifically this time of year, there's a dish, a really special one for this time of year of the independence called chile en nogada, that anybody who's Mexican listening could probably describe much better than I could how it is. But it's delicious. It's a chile, not a spicy one, but a large chile stuffed with this special mix of sometimes meat, sometimes rice, but always like bits of apple, pear, raisins. And it has a special sauce on top that's made of nogada, which is a kind of nut, like a walnut. It has the colors, the green of the chile, the white of the sauce of nogal, and then pomegranate sprinkled on top for the red of the Mexican flag. And it's special around this time. It's seasonal and it's served around the Independence time. Delicious.
Well, I will have to try that out. I don't think I've ever eaten that, but it sounds amazing. Is it spicy? I imagine.
No, it's not really spicy. It has kind of that nice, like grounded sweetness to it, a little bit from bits of fruit, and then just a tiny little kick because it wouldn't be Mexican food if it didn't have it. Just a tiny little something.
Well, that's wonderful. And I wanted to talk a little bit about the culture and the great things about living in Mexico before we dive into this topic, which is, not quite so uplifting, which is, the lack of access to healthcare on the migrant trail. So you told us that much of your research was with international migrants transiting Mexico and about food security and their coping strategies. Can you elaborate? And can you tell us also how many of the migrants you think are headed towards farm work in the U.S.?
Sure. So Mexico is very unique in the way that is one of the largest migrant corridors in the world, of course. But what makes it a bit unique is this aspect of transit that it has, which is ever increasing in the past few years, particularly marked in a very public and international way by the crossing of the large caravans in 2018 to 2019. But that was just representative of a greater trend that we're seeing of an increase in transitory migration for Mexico. There are always exceptions, of course. This generally, as an average, represents people who are Central American heritage, of more than anything from Honduras in these days, particularly, that are transiting Mexico in order to arrive in the United States. Many of them are still coming for economic or for work purposes, but many, and an ever increasing amount are subjects of international protection, meaning that they have a founded fear for leaving their country. They're not there for fun, right? And a lot of them are destined for work that may or may not be farm work. A lot of times they're going through personal connections that they might have to wherever they will be able to get dignified work, but a slightly increasing percentage of them are going to the fields in the United States as well, and particularly as they fill gaps for some Mexican people who are now a bit more starting to return to the United States. They still represent the minority. Non-Mexicans in general still represent the minority of farm workers in the US, but there is a slightly increasing percentage of them. And according to some estimates, and something that for my personal criteria, I would also expect to see in the next few years as we try to comb out some of the pandemic effects, is I think that will be a trend that will continue to increase. But the transitory paths through Mexico are very complicated, very hairy, marked by violence and organized crime. And they tend to follow particular routes. A lot of that goes by the train called La Bestia. It's a train that passes from the south to the north and splits off around Mexico City, particularly into two big different routes. And it's the way that a lot of people, in a free way, they board the outside of the train and they transit Mexico to arrive at the United States. It's incredibly risky. It exposes people to an incredible amount of violence, danger, and risks to their health and well-being. And it has sort of bases the migrant route that's the most common that we see through Mexico in these times. It's important to note too that not only the quantity of people transiting Mexico is increasing in these times, but also the profile generally of who we're seeing transit Mexico. Always and still the majority are men who are of working age and who often are going to the United States to work as well, in work specifically in the field, some of them, and others in other industries like construction. But an ever increasing proportion of them are priority groups. They are women, they are children, and there is an enormous amount of unaccompanied minors arriving at the US border.
That's interesting because given the shift in policy on the border, one would expect that there will be a decrease in migration since the migration is actively being discouraged by these policies. But you're saying that the opposite is in fact true, that it's increasing.
Absolutely. And it's a really good point that you brought that up because we have absolutely no evidence anywhere, actually, not just in the Americas, not just in this migrant corridor, but anywhere to support the fact that increasingly more nationalistic, encapsulized policies against migration actually make migration decrease. There is no evidence of that. And in fact, usually the opposite is true. Nothing is going to stop migration. And in fact, except when people don't want to migrate. And that's why there's an ever increasing attention in the international agenda on focusing on, number one, the fact that migration, international migration, is an economic boon to all of the countries involved of origin, of transit, and of destination. International migrants represent less than 4% of the population of the world, but contribute almost more than 9% of the what do you call the PIB? I forgot it's the Spanish acronym for it. I forgot of the gross income of the countries involved at the worldwide level. It's an incredible amount. And so we focus more on migration as a positive thing and how to deal with it in that light. And as well as saying, if we actually want to stop migration or slow migration down, and we should, why? For the benefit of the people, to say we don't want people to have to leave their homes. We want them to be able to. We don't want them to have to, right? The focus on stopping that is never going to be policies that close the borders. That's just going to create more danger in the crossings that are going to happen anyway. The focus will be and continues to be on in the international mark of the United Nations on addressing factors of development in the countries of origin and making sure that people can live a dignified life where their family and where their home is and where their friends are, instead of having to make a potentially dangerous decision or one that's going to not allow them to be with the people they love.
Can you tell us a story about one migrant that you encountered on the International Migrant Trail?
It's it brings back so many. I've been very lucky to be able to talk, even just in my small experience of these past few years, to be able to talk directly, not only in the context of interviews, not only in the context of surveys and things that I do, but whenever I go to the migrant houses, I live with them, I eat with them, I cook with them, I sleep around them in the same areas. And just to be able to talk and get to know them as people has been incredibly valuable for me. And I love meeting people and being able to hear about what they care about. I think one guy that I remember named he was from El Salvador, and he was telling me about all of the beauty of El Salvador. He was so excited that he said, even though I think I will never go back to El Salvador, I want El Salvador to be a place that you can go to and that you will not have to be scared, because I live in the most beautiful country in the world. But then he went on, he was a woodworker, right? And he went on to tell me how excited he was about all the wood in the United States. That was why he wanted to go to the United States, because there was different kinds. There was hickory and there's oak in the United States that he always wanted to work with, and had seen some beautiful works of people in the United States. And he was so excited and actually sat there sketching for me different things that he wanted to do and describing different grains of different type of wood. And he was so excited, not to arrive, not to take resources or something from one country or another, to contribute and to collaborate and to use everything he had in the labor market of the United States to contribute something really amazing to our country and to everyone, both immigrant and non-immigrant there. Another little girl that I met was really impactful for me, I think, and I was very lucky to be able to continue speaking with her and her mother, who were on the trail after I had to leave even. And she was one of the smartest girls I have ever met in my life. She was 9 years old, and she had a physical disability as well, which inhibited her, both her and her mother, even though they were traveling on the train, which was difficult for them. And she was one of the smartest girls I've ever met. She would follow me around asking me questions and then trying to answer them and figure out if she was right or not. She already had an answer that she was pretty sure was right? But it really highlighted to me, for example, the lack of access to education that people on the migrant trail have, and the fact that if she arrives in the US, might have to start working immediately. Because that's the only way to be able to, in certain circumstances, achieve a dignified level of life in the circumstances that they now find themselves in, although they were pushed without wanting to be from their country for reasons that threatened their lives. It's really unthinkable to speak to such a bright, such an intelligent child and know that I'm not sure when she might next be able to go to school again. So it's something that that motivates And it's something that makes so valuable, the work that you guys do at AFOP and Children in the Fields, to pay attention to this problem, to provide training, to provide opportunities, and collaborate on a domestic and international level to respect.
Did you see a kind of a growing number of kids? I know you don't have hard data, but just anecdotally, did you come across a lot of kids?
Many. There was a very well understood peak in the level of children that were being detained at the U.S. border in 2014, when under the Obama administration a humanitarian crisis was declared for that same reasoning. There was a slight dip after that, and there has been a slight augment. Like you said, the data is behind. There's certainly no official data yet as respects to what's going on during the pandemic, and it will be up and coming in the coming years. But there is, again, a slightly increased amount of children that are on the trail. Of those, numbers have said before, for example, from the MF, which is the survey that's undertaken by the Mexican Institute COLEF in the northern frontier, which is the southern border of the United States, that say that more than half of those children are unaccompanied by adults as they enter the United States. Some people, anecdotally, and it's sort of understood to be known, that some people consider that it can be easier to cross the border as an unaccompanied minor. Because there's a potential that you might receive a bit more pity or some social service that would not be available to an adult. But in turn, that results in some pretty scary situations of vulnerability for these children. There is an increasing amount, as I mentioned, of children in general that we know that are transiting Mexico, whether or not they do arrive finally at the U.S. border and or cross, and an increasing amount that are unaccompanied. These are conditions that being a child in general puts you in squarely as a priority population under the Declaration of Human Rights of the United Nations, under the International Pact of 2018 for secure, ordered, and regular migration, and in every national U.S., Mexican, and Central American judicial framework. So it's something that needs to be a focus in these times.
Definitely. And it's so hard to keep track of the constantly changing policies and the reasoning that is behind them. It's hard to know, I guess, especially even for the migrants themselves, like what the situation is going to be like once they arrive. It could have been one thing when they left, but something different when they get there, and they could no longer be allowed in. So I did hear from a friend, and I mentioned this to you separately, that 14 seems to be some kind of cutoff where they do not even allow others in. And so I personally know someone whose cousin had to send her kids alone across the border because they just wouldn't let her in. And I just can't even imagine how scary that must be as a parent. So yeah, I don't even know what to say.
But it's incomprehensible. It really is. And I can't imagine as a parent what you think seeing those kind of circumstances. And again, always remembering that these are people, not every single one by any means, but these are people that, generally speaking, have not wanted to leave their country.
Mm-hmm.
Nobody wants to find themselves in the circumstance that they are waving goodbye to their children across a border, that they are potentially subjecting themselves to these kind of circumstances. People are leaving for extraordinarily justified reasons and are encountering a system that is changing every step of every day before the circumstance even of the pandemic, right? And this kind of confusion has led to the fact that in the past few years, the number of people applying to asylum and a status of refugee in Mexico from the Central American countries has increased more than 3,000%. there is a massive increase in people who are subjects of international protection who need to be able to reach a safe space and by international law should be able to. But they are trying to get into the United States and are encountering waits more and more that are so long that they can no longer consider themselves to be in transit anymore. When they encounter those waits, more than anything because of the migrant protection protocols enacted since last year at the border of the United States, they find themselves living in situations of squalor, of camps that they are prey to organized crime even more than before, that there are children with no supervision that are living in crowded spaces where they don't have access to even the most basic sanitation sometimes, to a right to food and everything. And these are the kind of circumstances that people are looking to avoid, that everyone is looking to avoid. And in days like now, when there's a pandemic, everyone should be looking to avoid those circumstances more than ever. The pandemic affects everyone, but it does not affect everyone in the same way or to the same magnitude. But if some are unsafe, in circumstances where they are detained, even though they're only an administrative fault, they are not criminals, or circumstances where they don't have any choice but to stay squatting in camps with many other people who they don't know, plus they don't have access to healthcare. That's a danger to them, and then further to everyone when we're dealing with a communicable disease.
Yeah, so healthcare, how can individuals, if they need it, access proper healthcare while they're on the migrant trail? You mentioned the migrant houses. Is there some kind of system also with healthcare in Mexico? I mean, for migrants, obviously for Mexico, but for the migrants themselves.
Yeah, so there's a system in Mexico that has universal health care for everyone to a certain extent. And it's a little tricky to talk about in these days because directly before the pandemic, January of 2020, January of this year, the health system of Mexico as a whole experienced a massive shift. It changed from something called Seguro Popular, which only allowed migrants, international migrants who are undocumented, to access the health system for a period of 90 consecutive days. This system changed in January of 2020 to a new system called INSABI. Under this new system, it's theoretically going to be able to apply universal healthcare coverage to migrants at no cost, without having to have legal status or administrative regular status inside Mexico. The problem is, and obviously it goes without saying, the pandemic has interrupted all of this and has created so many problems for the people trying to make this a reality, is that we still don't have official documents from the public sector about exactly what the mechanism for that access is. For example, what documents will be asked for when one arrives. Is there a period in which they will have access, migrants will have access to this care and then not, as in Seguro Popular before, or will it be unlimited? Is there a packet of services that will be available, or will it be free and unlimited for whatever is needed? For example, will it be in the segmented Mexican system? Will they be able to go to any hospital, or will it have to be a special kind of hospital? So all of those questions are sort of still in play right now, and because of the change to the new system. That lends itself to confusion, an enormous amount of confusion, where even the people who are trying to do their best in the hospital and medical system do not know whether they can care for migrants or not when they arrive. They don't know. And then on top of that, having a system that has now had to turn to an immense level towards COVID and leave other things behind, prioritizes nationals within the system and prioritizes certain kinds of symptoms and certain kinds of diseases and leaves others out in the cold. The first people who are left out in the cold are international migrants, right? Within that too, there is an incredible network of migrant houses here that are part of the social civil society of Mexico. They include centers that give a juridic orientation, that is judicial orientation, as well as many, many that provide just the basic services, just somewhere to spend the night, get some food, get some help, get a map, and things like this. These are critically important to the very life of people who are transiting Mexico, and they are run by such an incredible network of people, but that receive very, very little, if any, assistance, either financially or technical support from the public sector, right? But these things are critical to to ensuring the human rights of people who are transiting Mexico, even though that is the responsibility of the state. And within them, a lot of times within these very migrant houses, there are services that provide basic health services, mostly through volunteer doctors and nurses and things like this. And that, for almost all people who are crossing Mexico, is the way that they get health services when they need them. And this is a group of people who, generally speaking, the most common ailments that we're talking about medically that they might need medical attention for are quite similar to ones that you would see anywhere. They're coughs, they're upper respiratory infections, always. There are minor and sometimes quite major injuries physically. There are many amputees from falling off the train, for example, and pregnancies. These are some of the most common needs of the medical system to attend in migrant people, and generally they're attended in civil society and not in the public health sector.
It's fascinating. As you're talking about the system in Mexico, I'm trying to think of the equivalent in the US. I guess the migrant health system in clinics here in the US can be the same kind of the safety net for migrants. And there's not enough of them. You know, obviously there's they're few and far between, but the ones that are there are so important because many of our farm workers are undocumented. They have nowhere else to go. And even if they can go to the migrant clinic, they still don't because they don't have the time to take off from work. So yeah, I wonder if there's any of that, if people just say, oh, it's nothing, and, you know, just keep going. And even if they could go and get medical care for their sprains, or, you know, I'm imagining that it's similar. I don't know what the Spanish word for it is, but, you know, brushing it off and trying to say, no, I'm tough. I can bear it. But
absolutely. And that's incredibly frequent for the level of access, as you say, that most farm workers who are foreign born in the United States have. They have barriers to access in all dimensions of access. Because when we talk about access to a healthcare system, well, what does that mean exactly? Well, we can say, well, you have access to this system, but you can't afford it.
right.
Okay, you lack financial access then to that system. Well, you have access to the system, but it's the next state over. Well, now you're lacking geographic or physical access to that system. And then when you encounter barriers like discrimination, like the inability to be able to recall your own rights and to be able to defend them because you are in a situation of vulnerability in front of an employer, for example, then that creates social barriers to access, right? So we're talking about access that's real to a healthcare system needs to create an environment where access in the financial, physical, and social environments can actually be realized, right? This, in the context of migrant farm workers in the United States, is extremely, extremely difficult in certain circumstances. As well as, like you mentioned, there are certain different risks that farm workers are going to face both in the United States and elsewhere that are unique to their line of work. Work is a social determinant of health. And very much so when we're talking about in the field where you are exposed to extreme levels of heat. Sometimes you don't have enough breaks, you don't have access to potable water, and you are exposed to chemicals of which you are unsure about how they're going to affect you. These all create differences in your needs that you have to be able to access in the healthcare system. Something that I think on from my personal criteria is very concerning when it comes to migrant farm workers in the United States, and particularly children, because of their physical exposure to it, is pesticide exposure, and how that's something that is simply not going to be taken on in a healthcare system because it requires an immense amount of understanding of continuity in service to be able to figure out the long-term effects of something that can be quite gradual to a person's body and to a person's health, much less to what it could be doing to their family when they bring it home. Right.
Yeah, man, I just thought of that study, and I'm going to put it up on the screen. The Comagos study is the only one that I know that is following kids for years, to study the health effects of the pesticides. And that's exactly what we need. We need more of that, of longitudinal, long-term studies that because it's a long-term thing that you just can't understand with just one 1 year's worth of data or whatever. So yeah.
Absolutely. And there's been that's from Berkeley, correct? From UC Berkeley.
Yeah.
The University of California and all of its different sites really does have a fantastic wealth of information on these kind of things, and generation of this. And it's a good thing for us to be looking out for too, in the context of the pandemic, that of course everything is up and coming, of course, in these days, and everything is in progress. But UC Davis, if I'm not mistaken, the Dr. Stephen Wallace made us a presentation not that long ago in the context of the UC Berkeley Health Institute session on migration and health, talking about what we know about farm workers in California specifically, and their affectations in the pandemic in these days. I'm talking about, a massive amount of the force of our essential workers in the United States that are foreign born and are exposed to conditions that not only propagate the virus, but then generally lead them to have greater side effects of the same virus, that do not allow necessarily access to a healthcare system that's going to be able to not only treat or ameliorate the effects of these things, but also, and this is key, to be able to necessarily gather epidemiological information on who's being affected by it, and therefore try to stem the spread of this to other people. And then on top of that, horrifyingly, there are even situations that we're facing now that if someone does unfortunately pass away who is a migrant worker in the United States, there have been more and more stories lately about difficulties in even being able to get their remains back to their family, or sometimes even identify them. There was a massive memorial in Mexico City for the victims of coronavirus in essential jobs in New York City. That says something very strong about how tied together Mexico and the United States are, how Mexican workers in general, and in the agricultural sector particularly, where they represent 75% of the people there, are absolutely critical to everyone's development and everyone's well-being in the region.
I don't know if you saw this, but there's some testimony that I shared just recently on this page from Vicente Reyes. And he's like, I don't feel like I'm essential. He's like, not the way I'm treated. And yeah, so my heart breaks for all of the farm workers who have been exposed and continue to be exposed to the coronavirus without any regard for the their health. I mean, it's more like let's get the crops in, let's get the harvest in, before time's wasting,
Absolutely. And here they are facing fires all over the place. Here they are facing, they are heroes right now, as stereotypical as that might sound right now, because it's so easy to throw that word around, but it should make us, if we can look at a silver lining of what goes on in these times with this massive health issue that's affecting the world in every single sphere, is that we need to recognize that essential is more than just a word. It is the thing that we truly cannot live without, that we cannot turn off. And although a lot of times our supply chains have made it so we can put our blinders on and just pretend that food is born on the grocery store shelf, that look what happens when all of a sudden that chain is interrupted or even just shaken up a little bit. For example, like what was happening in the beginning of the pandemic, when the supply was there, the demand was there, but the distribution and packaging links could not adapt quickly enough to immediately put things back on the shelf, for example, or distribute them appropriately, right? Migrants and people who are foreign born are by far the people who contribute most, not only to the production sector in agriculture, but also to the packaging, even the distribution sector of this. And it's an incredible wake-up call to everyone how critical this is, and how, if we don't treat people in a dignified way, then it'll be everyone who loses in the end. Everyone.
I remember what you said about making it not necessary for them to leave their home country, but possible. And so I think of the same thing, like make it not necessary for farm workers to be heroes, but possible, and make the conditions better so that they're able to live healthy lives, even as they do heroic work.
Absolutely, because, they didn't sign up to be heroes.
Nope.
They signed up to get some money so they can support their family, right? They signed up so that they can be at peace and be happy just the same as what everyone else wants, be in a safe place and be able to raise their children, maybe take care of their parents, whatever it might be. Just like people who pick up trash in the city, they all of a sudden just gotten into a very scary position with their level of risk and exposure. They did not sign up to be heroes, but that's what they've had to turn into, because they can't hide and put their face behind the curtain and hide in their house. Like we've been so lucky. I've been so lucky to be able to do some telework, and even on my degree as well as in other work these days. It's just not possible for them. So the best way that we can repay them is to give them not charity, to give them a dignified opportunity. That's it. That's it.
I think that's a great note to end on. Do you have any resources? Carrie, where'd you go? Are you still there?
I'm still here. Can you hear me?
I hear you, but I don't see you. That's really weird. Well, do you have any resources I can throw up on the screen, or anything that you would like to say before we go?
I don't have right on hand right now. I don't have up any of my particular publications or anything that we've been working on, but I'm really excited and I'm really happy to be able to just like have this space and talk a little bit about it, because there's so many times that we focus by borders, and this very situation of the pandemic and the situation in general of the migrant phenomenon does not respect borders. It is exactly the opposite. And it's really telling in these days how we are failing when we try to create politics that only center on borders and center more and more on encapsulating ourselves in views of national security as opposed to international human rights, because those are never going to jive with an appropriate level of secure, ordered, and regular migration that benefits everyone involved, right? I'm really glad to be able to connect it a little bit, to try to put these pieces together and discuss, migrant workers in the United States came from somewhere, and I'm standing in a place where some of them came from right now, an enormous amount of them, right? And a lot of them are passing by us right now on the way. right? So taking on what the different vulnerabilities that people have to be faced with, or better said, the vulnerations that people are faced with along the migrant route, generally speaking, as they're arriving in the United States, is just looking at a different facet of the same general issue, right? It's an issue of saying we have a human rights framework to work with since 1948. It is not a secret to anyone. Everyone is involved. Practically every country in the world has signed on to this. So it's a matter of practicing what we preach and going, it's always going to be a focus on human rights for everyone involved and dignified life for an adequate level of well-being, especially for people who work in the fields and in places that benefit all of us. That truly will be a boon to everyone involved on an economic and social level. There is no division, right? And so that's why we've been glad to be able to work a little bit these days and in the context of domestic and international cooperation, and in always in the human rights framework. As I worked some with the Human Rights Commission of Mexico City too, some of the things that we've been working on in the context of the pandemic have been updating our work and publications on health access for migrant people in transit for Mexico or without regular status in Mexico. And also, we've been working on integrating the international scale for measuring food insecurity in the access dimension, because there are several dimensions, into studies that look at resource access for migrants in Mexico. That is people who are subjects of international protection, people who are farm workers that cross back and forth for seasons or for temporary terms. And we'd like to start incorporating food security as a general measurement in the data that we're gathering from people to start to get an idea. To give you an idea of what we're talking about when food security is involved, on a national level in the United States, there's only about 9% of the population that's in conditions of food insecurity. Food insecurity is having to have an important and notable, such to the point when it creates health consequences, diminishment in the amount and quality of food that you are eating. It's hunger and it's more. It's hunger today and it's your possibility to receive or get food tomorrow. That's food insecurity. And if only less than 10% of people in the United States are suffering from food insecurity, we still have a little ways to go, right? Absolutely, absolutely, especially at the level of equality. But when we're talking about studies that have been done in migrant farm workers and their access to food and levels of food insecurity in the United States, some studies have shown up to 82% of migrant farm workers in the United States suffering from moderate to severe food insecurity. That is general population of the United States, 9%. Migrant farm workers up to 82%. That is unthinkable. And it is similar to what we're seeing in migrants in transit in Mexico, where we've measured, according to the international scale, about 75% of them are suffering moderate to severe food insecurity during their transit for Mexico. This is serious, and it's really a massive human rights issue at the most basic level, right? So it's really important to keep collecting data on that so that we know who to target, where to target, to reach better levels of equality and take on the lack of access to basic rights that migrant farm workers in the United States, as well as in other areas, have. I'd be happy to share some. I don't have them right on hand right now, but maybe afterwards on the page, I'd be happy to share some of our latest publications that also have to do with data collection and trends in data collection of all the Americas on migration and health, mostly at the Mexico-US border and on the border of Colombia and Venezuela.
That would be great, Carrie, if
Absolutely.
you could do that. I tried to distill that last statistic and I put it on the screen because that's something I actually didn't know. And it's incredibly and tragically ironic because the farm workers are the ones picking our food. and that there's such a disparity in the percentage of migrant farm workers who suffer food insecurity as opposed to the general population is shocking, even to me. And there, I see you in the stream again. So I'm going to put
I'm
you
here again. What happened?
I don't know. There you are. Hi.
Just talking about food insecurity from the distance. Here I am again.
Well, I'm glad your voice never left us, because otherwise I would be really scrambling. But anyways, so I think, is that what you just said? 9% of the U.S. suffers food insecurity, 82% of migrant farm workers.
Exactly. Yeah, there have been studies that have also shown it to be a bit lower. Generally, of the migrant farm workers, there have been studies that have showed it at around 62%. I think was the lowest one in a revision of the data by Kian and Mendoza a few years ago. But yes, up to 82%. That specifically, if I'm not mistaken, was in a certain group of farm workers in North Carolina. And so it's really incredibly, starkly critical when we look at it that way, that this is, when we're talking about migration, when it comes down to it, we're talking about a different sector of the population, and it's an equality issue, right? That's why sometimes these averages of data can be a little misleading, right? If we look at what's going on, it's a similar phenomenon. If we look at what's going on in the United States, we see that it's 9% is the average, but we're going to see that in certain populations that have certain characteristics of conditions of vulnerability, that number is a lot higher. And then in lesser conditions of vulnerability, that number is about 0. So it's when we're talking about migration, we're always talking about that aspect of what makes a person who's in a migratory process so quote unquote vulnerable, or what makes their conditions to be so vulnerable. And there are exceptions to every rule. Migrants as a whole are an incredibly diverse group of people. They're not defined by some innate characteristic. You're talking to a migrant. I'm a temporary resident of Mexico. I'm not currently suffering food insecurity. Why? Because I have certain other characteristics that help me be able to confront that. But across almost all migrants, as different as we all are, as different as they all are, a common condition that tends to contribute greatly to potential food insecurity, particularly for migrant farm workers, is a lack of social resources, both on a formal and informal level. That is to say, formal social resources would be access to Social Security, for example, access to the healthcare system that has a formal network with the objective to help. Whereas informal networks are your family, your friends, your neighbors, the people who, in a circumstance that if you were in your home locality, that would be able to give you a hand if you are suffering something. That's one characteristic that almost all people who migrate have: reduced amounts of social networks to rely on. And so that's a really good place to put our focus on. We talk about people who are in conditions of vulnerability, but really what we're talking about then is, the ship is just as strong no matter what, but is it in calm seas or is it in a storm? We're talking about people who are in conditions of vulnerability. That means that they're confronting a lot of vulnerations externally. So what we can look at and what we can change is, how can we change the environment around migrant farm workers, particularly priority populations like children, to be able to allow them access to a dignified life.
Yeah. And I am grateful to be working for an organization that tries to add to migrant seasonal farm workers' social, what was it, the word you just said? The social access.
Social resources.
Yes. So AFOP and all of our members, provide so many different services, wraparound services, oftentimes to migrant seasonal farm workers, to distinguish from the topic we're discussing currently, which is the international migrants, but migrants within the U.S. And provides them with emergency services and job training services and sometimes healthcare. And I'm very grateful for that. So There,
Absolutely. APOP plays such a critical role in two things, really, in the cooperation on a domestic level of pulling everyone together. It would be very difficult without organizations like AFOP that kind of pull everyone together and have a common ground that people can communicate through, that people can access resources through, even exchange information through. That's domestic cooperation. And that's an incredibly important piece of it, as well as, again, it comes back to not charity, opportunities.
Mhm.
The Farm Worker Opportunities Program that gives access to these kind of programs and resources, as you said, that is the best thing that we can do for people, particularly when in other environments they are lacking those social resources.
Well, Carrie, our time is almost up. I'm so happy to have gotten the chance to talk to you.
Yay.
And I don't think we got any questions per se, just a lot. Oh, we did have one question from Jonathan about how he can study his master's in the US if his degree is in Mexico, but I'm not sure if that's your area of expertise since you did the opposite.
I'm glad to hear that question though, because actually I was a Fulbright Garcia Robles grantee from the United States. But Fulbright, for those who aren't familiar with it, it's a program through the Department of State of the United States, and it's a massively wide-scale program that has two directions. I was a U.S. grantee that was able to get a grant to study in Mexico. However, the other branch of that, which is bigger, is for Mexicans to be able to study in the United States. I would really invite Jonathan, anybody else who's out there thinking about it, to check out Fulbright's website. It's wide and there's a lot of resources, but to be able to find, you can access the website to be able to see specifically Fulbright Garcia Robles is the connection between the US and Mexico. And there are lots of opportunities to pursue under Fulbright postgraduate education in the United States for people who are Mexican citizens and who have previously studied in Mexico. So that's a great opportunity. I would really invite you to check it out. And Fulbright, I am eternally thankful for Fulbright and to Comexis, which is the country here in Mexico, which is the country group who have allowed me this opportunity to not only study on a theoretical, on a desk, on an armchair level, but to be here where I wanted to be, to help me with my language skills in my second language, and to actually be more immersed in this topic so that I'm able to talk a little bit more about it today and be able to collaborate with people here doing incredible work to guarantee human rights here for migrants.
And it really is awesome to talk to you like right now when I knew you, 2 years ago when you didn't know any of this stuff.
Right? I know. AFOP was wonderful, and I would not have ever left if not for the fact that Fulbright had given me this really amazing opportunity. But I learned so much from you guys at AFOP, and I continue to. I follow you guys in your social media networks all the time. Sometimes you see my little likes and comments out there, but always following you guys, and I'm really glad to have this just channel for collaboration and to be able to chat about these things. Everything's up and coming, and with this pandemic, we will be seeing in the next few years a floodgate of information trying to keep up with everything that's going on. And everyone plays a critical piece, a critical role in that to be able to keep up, monitor the situation, and create actions that are based in the evidence.
One comment from our dear Kitty Nelson says that a lot of our AFOP members have also developed relationships with their local Mexican consulates and other local and international representatives, depending on the population that they're serving. So AFOP members are involved in international partnerships too, which is something that not everyone might know. So thank you, Katie, and she loves you.
Yeah, wonderful. Thanks, Katie, because absolutely. And the Mexican consulates in particular, for there being so many millions of people who are or of Mexican heritage, double citizenship, or who are Mexican citizens within the United States, the Mexican consulates have a wonderful system of what they call ventanillas de salud, like little windows, health windows, where people who do not have our fascinating level of private healthcare that we have in the United States, thanks to not having a universal healthcare system, can get access through the Mexican consulate to healthcare services and references or recommendations to specialists, for example, when they need it, as well as for preventative healthcare services. I'll also share with you later that a very close colleague and friend of mine, who I'm working with now from the Universidad Iberoamericana in Mexico City, has done extensive work with Mexican immigrants in the United States and their access to healthcare, specifically focusing on through these ventanillas de salud in the Mexican consulate. So I'll be happy to share that with you guys too.
That would be great. Yeah, that Mexico sounds amazing.
It is a fascinating place and an incredibly diverse place. I feel like I've seen so little of it, and I have a whole world still to get to know here.
Well, in another time, and if you're still there when this is all over, I'd love to come for a visit.
Please do. Like they say here, aquí tienes tu casa. Aquí tienes tu casa.
Well, thank you. All right, Carrie, we're going to close this up. We're right at the 60-minute mark, but thank you all for joining us and listening in. We'll have another live Thursday next Thursday as usual, but at our usual time of 12:30. So stay tuned, and thank you to Carrie. Thank you.
Yeah, thank you so much for inviting me, Kendra. I'm really glad to be here with you guys, and happy always if anybody wants to connect on any social media networks or there, as I'm on the Facebook of Children in the Fields, as well as my name there on academia and on ResearchGate. And I would love to hear any further questions. Thank you guys so much for having me here, and I hope we can continue this conversation and keep sharing.
Me too. Yes, we will continue to be in touch, I'm sure. All right, bye.
All right. Bye, Kendra. Bye, everyone.